The following segment of Daytime Buffalo is sponsored by Univera Healthcare. Today, we're talking about an important topic for older adults, how preventative care and annual wellness visits can help Medicare members stay healthy and independent. Joining me now with more information is Dr. Lorna Fitzpatrick from our sponsors at Univera Healthcare. Thank you so much for coming in today.
Thank you for having me.
Of course, Dr. Fitzpatrick. Let's start off by talking about why preventative care is so critical, especially as we age, right? And what role do annual visits play in that?
I think it's so important. Preventive care at any age is critically important, but particularly as people age, you can have more chronic conditions, more illnesses, more things going on, and we really want people to get in and have a talk with their doctor at that point. So really, the role of the annual visit is look at your doctor as your partner, as your advocate, and spend time with them. It's really a time to sit down without sickness, without illness, to have a conversation with your doctor about what you need, what you might need, what immunizations, et cetera, you might need, but also to really have your doctor know you. It's an opportunity for that, which I think is incredible.
Yes, and getting to know you is important, right? Because then when something is off, they've established kind of your norm and your baseline. So if there's anything, they can see those signs as well, right?
Absolutely. It's so important to have really having your doctor as your advocate and really knowing you, I think is so critical to any wellness visit and sick visits. It's important to both. But the annual visit really gives you the opportunity to get to know each other.
That's right. You mentioned immunizations, but talk about those immunizations or screenings that people should be thinking about and how often they should be receiving them.
Yeah, so again, that's a conversation to have with your doctor to see what you need, and it depends on your age. Screenings for cancer, we know they're so important, right? Colon cancer, breast cancer, other types of cancer, screening for them to see earlier you catch them, the more chance you have of living a long and healthy life. So we really want to look at that. Immunizations, so critical, right, to preventing. We have a big flu epidemic, flu is going around right now. It's very prevalent out there. We want to make sure people get the message out to get your annual flu shot. It can really do it. Shingles, other things that you have are out there for vaccinations. We really want to make sure people are out there getting it. But all of this is a conversation with your doctor who will sit down, have a conversation with you and do it. And don't forget also things like fall prevention. Are you safe at home? Who do you have looking out for you? Do you have someone who can drive you places? Those are all part of the conversation in a wellness visit too.
Well, that was my next question is what should people expect from this wellness visit and what does it look like?
Yeah, it's really, again, that one-on-one time for you to sit down with your provider and just talk, which is so important. Go through all the medications. It is so important, especially with people who have multiple conditions, might be on multiple medications from multiple different doctors. You want that quarterback out there, right, looking to see that everything goes together, that it's all there, so that is important. What are your plans? What do you want? You know, what are your advanced directives? Do you have a conversation with that? Who at home is going to take care of you? Those kind of issues need to be talked about with your doctor with it. Fall risk, you know, are you at risk of falling? Are there things that we can do to help that? Because a fall can put you in the hospital for a long time. We want to prevent that doing it. And then going again, medical history, just that conversation. What doctors have you seen? What have they prescribed for you? What conditions do you have? Let's make sure we have all that information in one place.
What do you have to say to people who feel like preventative visits aren't necessary and those are the same ones that are putting those off, right?
Yep, and Mom and Dad, I'm talking to you with it. It's so important. I think that sometimes people get into the mindset that I don't have time, the grandkids are here, this is going on, holidays are coming, whatever may be going on. It is so critical to take the time to do it. It's really a great opportunity. Don't be scared of your doctor. Really use this as an opportunity to sit and get to know your doctor and have them get to know you. I think that's the most important message I want to give today about that. But really take it as a time to do it. Pick up the phone, make a phone call, get in there and do it. It is so important. It's as important as any other medical visit that you have to get to these visits.
Because preventative is the operative word, right?
Absolutely.
Like, these visits are to make sure that you're looking at your life as a whole and making sure the goal is to continue to be living and independently and healthily as possible, right?
Absolutely.
So let's get in before small issues become big issues, right?
Before they become big issues, for sure. You want your blood pressure checked, your cholesterol checked, all of those things. Someone just needs needs to check them and keep tabs on them and know what's going on and know when they need to look out for more, or when things are fine and you just need to come back next year. It could be either of those options.
Well, I'll give my grandma a shout out. Patricia Glover, she's on top of it. She gets her wellness visits. They come to see her at her home. Shout out to you, Patricia. You're doing the right thing, making sure.
Talk to my parents,
yeah.
please.
She'll call them. She'd love to talk. Okay, so how can our viewers get scheduled with their visit?
Simple. If you have a doctor, pick up the phone and call and say that you want to have your preventive wellness visit. It's so important to do that and say that you're not sick, but you just want to come in for that preventive visit. If you don't have a doctor, pick up the phone and call us. Call anyone to see who you can get as a provider to come in and get on the phone and make a phone call and get into the visit as soon as you can.
Alrighty, Dr. Lorna, thank you so much for coming in.
Oh, thanks for having
us. Talking about this. It's an important topic. So for more information and resources and a checklist of recommended screenings, you can visit UniveraHealthcare.com. This Daytime Buffalo segment is sponsored by Univera Healthcare. Thanks again for coming in.
Thank you so much.